Hey everybody, Paul Barrett from the Modern Medicare Agency, trying to make some educational videos for you folks out there that are new to Medicare and have all kinds of questions, particularly about the basics. Without understanding the basics of Medicare, and I know I'll probably put some of you to sleep already, you can't choose a plan properly. How do you know which is better, a PPO, an HMO, Medicare Supplement, Medicare Advantage plan, and all these other things? We have lots of choices out there, folks. So without any further ado, let me go over uh, Medicare Advantage plans, PPO network versus HMO network, just to give you guys some insights, help you out when you plan shopping. All right, so basically, we're going to talk about Medicare Advantage plans, PPO versus HMO, what's the difference, why research really matters, and it really does, and how we can help. Let's simplify the confusion together and make Medicare work best for you, okay? All right, so what is a Medicare Advantage plan? Guys, most people have no idea. This blows my mind. People tell me all the time, I don't want a Medicare Advantage plan or I want one, but yet they don't know what it is. All right, so Medicare Advantage is basically another way to get your insurance instead of having original Medicare. What does that mean? Well, it means that you don't have original Medicare paying part of the bill, and then you are responsible for part, or a supplemental part responsible for part. What it means is you're going to have a private insurance carrier. It could be Blue Cross Blue Shield, United Healthcare, Aetna, Cigna, Humana, WellCare. You get it. There's tons of companies out there, probably 3 or 4 dozen of them that are offering these types of plans. Now, they have contracts with the federal government. They're designed to cover everything that original Medicare covers, as good or better. They're going to cover Part A, hospital. They're going to cover Part B, medical. And most of the time, they're going to cover Part D. Very occasionally, they'll have no Part D coverage, but that's by design for certain folks that do not need it. If that's you, you'll understand when you see those types of plans. Maybe you have union benefits for drug coverage for life. Maybe you're a veteran and you like to get your prescriptions from the VA because they're cheaper. Makes sense, right? That's why you have it. They're always provided by private insurance companies. It's going to always be regulated by Medicare. So they have to follow rules and regulations. If they don't, they get basically, they lose their contracts. All right. They're gone. The better they perform, meaning if you look at a Medicare Advantage plan on Medicare.gov or in your Medicare New Guide, they have star ratings. The more stars they have, the more money they make. The more money they make, obviously, the happier they are, the happier their shareholders are, etc. And the happier you're going to be because when they get paid more and they get higher star ratings, they have to put a certain amount of money and benefits back into the plan. So, generally speaking, when we're looking at Medicare Advantage plans, the ones that have higher star ratings are usually going to be better coverage. Now, they also, these types of coverages will many times offer, and I'm sure you've seen the commercials, dental, vision, hearing, stuff like that. Almost all of them have gym memberships, which you should use, by the way, right? The best medicine is preventive medicine, right? Stay away from the doctor, stay away from the hospitals. Uh, that's always my way of thinking. But typically, with these types of coverages, what are we going to have? Either low or no premium whatsoever compared to Medicare supplement insurance. Now, that's not to, say that Medicare supplements aren't good coverage because they are. It just depends on you individually, right? Medicare Advantage plans typically give you more plan choices and more benefits. All right. That's why they're attractive to a lot of folks that just don't have the extra income to share. Now, what's a PPO plan? Very simple. We break it down. It's an acronym. PPO stands for Preferred Provider Organization, which means they have a list of doctors that they really would like you to go to. Those doctors are contracted at a specific rate, meaning they're going to have the best return on their investment if you go see those doctors, and you're going to get the lowest copays if you see those preferred providers. If you'd like to go see a specialist, you don't need a referral. Wonderful. I know most folks do not like getting referrals, it seems. Saves you time, less hassle, and let's face it, a lot of us see primary care doctors very far and few between. We're seeing specialists on a regular basis because as we get older, maybe we need to see the orthopedic, the endocrinologist, the cardiologist, the dermatologist, but not so much need to go see the primary care just to get a referral to see one of those other guys because you don't need to see the primary care. All right. PPO is great for travelers, plans flexible. Anybody, doctor-wise, that accepts Medicare, technically you could see, right? So that gives you a lot more flexibility. So you could see a cardiologist in another state if you want. Of course, you may pay more, but you can do it. With an HMO, unless it's an emergency, not the case. All right, so what's an HMO plan? Health maintenance organization, just another title for the type of network. A health maintenance plan requires you to use in-network doctors and get referrals for specialists. Not all the time, but in many parts of the country, they still require referrals. If you're local here in New York, less and less plans are doing that, but there are still network restrictions. You always have to have a primary care doctor when you get started on these plans. If you don't choose one, they're going to choose one for you. uh, Specialist referral requirements. Like I said, you may or may not have to get one, but the majority of HMOs still require uh, referrals for specialists. Network restrictions. If you see doctors or go to a hospital, except an emergency, you will not be able to see doctors out of network without being responsible for 100% of the cost. What does that mean? That means you're responsible for 100% of the cost. You go see a doctor because your friend said, hey, I got the best orthopedic. He's not in network. You have an HMO. It's not an emergency. You're going to be responsible for 100% of that claim. If the doctor's office tries to submit that claim, it will get denied. All right, so that's important to know. Now, keep in mind, some HMOs have really large networks, and it doesn't matter that they're an HMO because their network is huge and it has all the doctors you could possibly want. Others are very local, regional, and everything in between. So it's very important to pay attention to the size of the network. Lower costs in network. Yeah, of course. You're always having lower costs, whether it's an HMO or a PPO in network. Typically, with an HMO, you have lower out-of-pocket costs in general. The plans tend to be more benefit-rich, which means you get better dental, better vision, better hearing, more gym membership stuff, maybe an over-the-counter card to do some grocery shopping or go to the pharmacy and get some things like vitamins and Tylenol, things of that nature. If you're not familiar with an over-the-counter card, uh, I'm sure if you're new to Medicare, you will be soon. All right, so key differences, right? PPO plans, any doctor, cost may be higher. Referrals definitely not required, not for any of them, right? Allow higher cost if you go out of network. Uh, Cost, typically, it does cost more to have that freedom. The more freedom you have, the more choice you have, typically, the more you're going to pay for a premium, for a copay, things of that nature. Uh, so it just matters to you when you're a Medicare Advantage person shopping, saying, do I want to have more access for a higher price, or would I much rather have, you know, my limitations with my networks to keep everything as affordable as possible? There's a plan for everybody out there, and not every plan is for everybody. Travel is flexibility. If you're a senior and you're traveling a lot, then it's nice to know that you can see doctors in different areas of the country. Most of these plans also, whether it's an HMO or a PPO, just so you know, if you go out of the country, they typically provide overseas coverage for up to a max of $50,000, which is pretty cool. Original Medicare does not cover anything at all outside the country. All right, so HMO plans must be in network. Yes, you really must be in network if you want to use one of their providers to get the best benefits. Always network. If you go out of network, once again, I'm going to keep beating this dead horse. You will pay 100% unless it's an emergency. Most plans are going to require a specialist to have a referral. If you don't get a referral, there's a problem. It causes issues. So just keep that in mind. Out of network for emergencies only, and you're covered anywhere in the country for emergencies. So don't get scared if you're doing a cross country trip and it's just for a couple of weeks and you have to stop at emergency room or even urgent care. You can still get yourself taken care of because of the situation. You just can't go for anything routine. If you go for something that's routine, that's not urgent, that's not an emergency, you will have that claim denied and you'll be responsible. Usually lower cost, absolutely. Most of the Medicare HMO plans are going to have lower costs and give more benefits. Okay. Staying local and lower cost. That's what the plan is really designed for people that are looking to get the most bang for their buck and have the lowest out of pocket possible. Now, not all PPOs and HMOs are the same. Every plan's going to be different, right? I get these questions all the time because I'm licensed, I think, currently in 35 states. Someone will be like, how come my Humana plan cost me this, but my brother's only cost that, so on and so forth? Well, it's going to depend on your zip code. If you watch a lot of those TV commercials, if you ever try and get a quote online, they always want your zip code. The doctors and hospitals that are available, it's going to vary, right? We don't know which plan's going to cover NYU Langone, which is going to cover Montefiore, which is going to cover any network or any hospital until we look it up. Not every plan is going to cover all the major hospitals and doctors. Some are going to cover half of them. Some are going to cover three-quarters. Some are going to cover as many as possible. And then some are going to cover very few. This is why you need to research. This is why you have to make sure when you're comparing plans and you're putting your information in, be careful on Medicare.gov. They're very infamous for putting the plans that have the lowest cost at the top. Great, that's what we want, the lowest cost. Why would we want to be careful? Well, most of the time, those plans are the ones with the least amount of doctors, the least amount of star ratings, the least amount of customer service satisfaction in our area, particularly. But in most parts of the country, you're going to find the plan that shows up at the very top is not always the best. Probably 50% of the time, you're not going to find your doctors on that plan. They have great prescription coverage for the prescriptions you're taking, so that's one of the main reasons why it's put up there. Also, the plan may not have a premium. Most Medicare Advantage plans, still to this 2025, do not have a premium associated with them. So zero premium and low drug costs automatically vaults that plan to the top of the board. But if you have 5 doctors and you want to see all 5 doctors and you're not flexible about that, you want to make sure you look up the doctors before you start getting all excited about the summary of benefits for either the HMO or the PPO. Make sure that plan is going to fit your specific needs. The prescriptions you take, I've already said that. Prescriptions are so important to many of us. They're daily. We don't see doctors every day. A lot of us just take maintenance drugs. Maybe you see a doctor every 3 or 4 months to get that prescription refill. But you take prescriptions every day. So our prescriptions need to be covered, and they need to be covered at the lowest possible price. That makes the most sense. The extra benefits offered, they vary from county to county. It's very important to realize that. I live in Long Island, New York. We don't have a lot of benefit-rich plans on Long Island, but if we go a couple of miles to Queens, Brooklyn, Bronx, you see tons of plans. There's triple the amount of plans. There's so many more benefits, and that's because there's so many more seniors per capita. The more seniors that generally live in your area, when I say seniors, Medicare consumers, baby boomers, whatever we want to call ourselves these days, the more of you that live in an area, the better you're going to have as far as choices. So just keep that in mind as well. If you move someplace and there's no baby boomers around, you don't have anybody on Medicare, then most likely you're in a rural area that does not have a lot of choices. Now, why research matters? Well, first of all, proper research and education is going to help you make up your mind. It's going to make the most sense for which plan is going to fit your budget, involving health, involving prescriptions, copays, deductibles, provider network, etc. Hidden limits. A plan may seem ideal on paper, but often lacks access to preferred local doctors. Ding, ding, ding. This is number one. Like I said earlier, a lot of times you'll go to Medicare.gov, you put your drugs in, there'll be 2 or 3 plans at the top that show up quite regularly because they have a very robust formulary for drugs. However, they barely have any doctors that accept it. To me, that's no good. But if you're looking to be thrifty and save as much as possible and you don't care about doctors, then that might not matter to you. Coverage conflict. Some plans offer great drug coverage, but exclude your preferred doctors from the network. Or vice versa, right? You could have all your doctors and the prescription coverage stinks. So these are things that you really have to pay attention to, right? Paying attention to this stuff, I can't tell you how many people overlook it. They just see one thing and they just, boom, they go. Once you sign up for one of these plans, depending on where you live, you could be stuck. So we want to be careful. A lot of states out there require medical underwriting. If you want to move from a Medicare Advantage plan to a supplement plan later in life, you may be required to answer full medical questions. That could cost you premium. It could cost you conditions being ridered out, or in some states you might be declined altogether and not be able to get it. So important. Review. Medicare Advantage plans change yearly, so reviewing your coverage annually ensures that you're going to have the best fit for the new year. I can't express that enough. In 2025, we had some huge changes. So people from 2024 that just got on and saw the changes for 2025, it blew their mind. Many people got on a plan in August, September, October, November, December, towards the end of the year, and they had to change their plan because their plan was discontinued, because their plan changed so much by January 1st that it was just ugly to be on. So this is something that's going to happen again this year. I promise you. I'm not trying to scare anybody. 2026 is going to have some huge changes again. We're going to see, Medicare supplement prices going higher than we've ever seen. We're going to see Medicare Advantage plans leaving certain areas. We're going to see new plans coming into the areas and lots of changes in between. And of course, original Medicare, well, we're going to see premium increase, deductible increase, and things of that nature. Uh, the government, Medicare, CMS, all the carriers, doctors and hospitals, everybody seems to be crying about the same thing, overutilization. So very important, guys. When that type of stuff is happening and carriers are losing money, changes happen on basically a consistent basis, right? So every year you got to review. They can't change the plan so much in the middle of the year if that doesn't happen. But every new year, if you decide that you don't want to deal with it and you're just going to roll your dice and move into the next year, you could really be sorry, especially in 2026. All right. So make sure you get some help, whether it's with an agency like ours or somebody else. Sit down with somebody that's unbiased. When I say unbiased, they work with several carriers, and most importantly, all the major carriers. They're gonna they're going to take up most of the enrollments, and it's not because they have more advertising dollars. It's because they have robust plans, robust networks, better prescription coverage, etc. Local and regional plans, some of them are fantastic. Large majority of them don't have the firepower to have as many doctors and hospitals participating, and this causes them, if they have a bad year, to just either have to change their plan so drastically or eliminate the plan altogether. Things to keep in mind. A lot of change, guys. Boom. Next slide. Medicare Advantage plans, a smart choice? Yeah. Rising supplement costs. I said it before, and I don't think supplement plans are bad. I think they're fantastic coverage, and for certain people, they're a must. However, the cost of supplements has been skyrocketing through the roof for the last 40 years, and from everything that we see, forecasting says it's going to go on another 3 to 5 years. So just keep in mind if you're on a supplement plan and it's getting expensive, well, it's going to go up probably another 10%, 12%, depending on where you live. Some of these states that I'm licensed in, I've seen increases between 20 and 30%, believe it or not, for certain plans. Lots of plans are even pulling out of the market, which didn't used to happen with Medicare supplements. Usually it was only a Medicare Advantage thing, but now Medicare Advantage plans and Medicare supplement plans, both are, they're trying to figure out what's the best way to go about this and stay profitable. Affordable coverage options. Plain and simple. If you can't afford to spend a couple of $100s on a Medicare supplement and get a drug plan, then it's clear as day that a Medicare Advantage plan is going to be a good option for you. Keeping in mind that we're not going to be making more money 5 years from now, most likely. And what happens to your Medicare supplement? Your Medicare supplement goes up pretty much every year, right? Just went over the cost and the raises. But what doesn't happen is Medicare Advantage plans, since the inception, there's always been plans that cost nothing. To now, there's always plans that cost nothing. And a matter of fact, the majority of them are still zero premium. Now, there are some that have premiums, whatever. The premiums are still going to be far lower than a Medicare supplement. So it doesn't necessarily make it better, but it might fit your budget better, which means it's a better plan for you. Bonus health perks, dental. Who doesn't want extra dental, vision, hearing, maybe some grocery benefits? I personally am a big fan of the Silver Sneakers benefit. I really hope that you guys out there, if you get one of these plans, start using all these benefits to the max. There's studies out that show that a lot of people don't use their dental, don't use their vision, don't use their hearing, don't use their OTC cards, which is the grocery benefit, and they don't even use the free gym membership. But they want to hear about it during the presentation because that's what gets them excited, and they never use it. It's all in one coverage, one card, right? So if you have a Medicare Advantage card, it could be Blue Cross, Aetna, Cigna. You're going to go to the doctors, hospital, prescriptions, everything one-stop shop. If you're on original Medicare and you want to have complete coverage, you're also going to have a supplement card, and you're also going to have a Part D card. And if you want to have dental, you're going to have a dental card. You're going to put pieces of the puzzle together to make one plan. All right. So if you're ready to find your perfect plan, as the contact information, guys, you can check out our website. I'm not here to sell you. I'm here to help you. All right. There's our phone number on the screen. We're independent. We're going to shop all the carriers for you. If for some reason there's a carrier that we don't represent, because we don't represent every carrier in every county, full transparency, I'm going to tell you which one it is, and I'll tell you to get it. Only thing I'm going to ask you for, if I do refer you to a carrier that I don't work with, and most of the time, if I don't work with a carrier, it's either because I very rarely come across anyone that fits that, or that carrier doesn't want to work with outside agents. But if I do, all I ask is that you leave me a referral, or I should say a review online. It says, Paul's a nice guy. He did this presentation for me and he helped me find a plan that he made $0 on. If you're willing to do that, then I'm willing to help you. Pretty simple stuff. All right. We're always here to help answer questions all year round. So if you have any questions, drop comments below. I'm going to have this video on YouTube for sure. Probably be on, Instagram, Facebook, a couple other things too. But any questions you guys have, we love to answer questions. That's why we got into this business, because we realize Medicare can be confusing and we want to simplify it for you. All right, guys. Thanks so much for stopping by and watching. I hope you found this helpful, and I look forward to speaking to you.